big C, the emperor of maladies. A diagnosis of cancer still evokes much more emotion in the patient than many other diseases. And perhaps it is partly because of this fear that early detection is not done. People don't get themselves checked up. They don't want to hear what they don't want to hear. But not just fear. In the issue of breast cancer particularly, women's health tends to take a back seat. Every single one of us knows somebody who has fought cancer, who is fighting cancer. So in this way, it's a disease which is really on all our minds. And the cure for cancer, it sounds like a holy grail, really, of medical research. And in a country like India, a poor country like India, it's not just about the research, finding treatments, finding ways to deal with it. It's also about finding affordable care, care that the majority of the people in this country can afford. It's not enough for the treatment to be out there. It needs to be accessible. To talk about the current status and the road ahead, we have an absolutely fantastic panel here. Devika, to start with you, to start on a personal note, what was your moment when you discovered that you had cancer?
Anybody, the first time you're told you have a cancer, it's the, the floor slips away from you and you're standing there in shock. And the first question you ask is, why me? You believe also as an Indian woman that cancer really would never touch you. It's something that you've been reading about and hearing about in the foreign press, but you don't really think it happens to you. So it was a terrible shock, disappointment. You don't know where to go from there.
Was yours an early detection?
Yes, it was very early. That's when I realized that caught early, cancer can be cured, and it's been 15 years down the line, and I look upon it as absolutely, something that was behind me now. And that's what motivated me into doing the work that I'm doing today.
Now, you're an educated woman from a relatively privileged background. You managed to get this checkup, but do you see a great reluctance to get this checkup among women in a country where women are shy to go to a tailor to get themselves measured for a blouse?
Absolutely. And it's not only the financial constraint, it's also the misconceptions about cancer. And, you don't want to even know that you have a cancer eventually. So even if you feel and you have a lump and you should get it, you hide it from the family. And then it's too late. It's stage 3, it's stage 4. And when you're forced to go, you realize that, it's not so curable at that point. Basically, the men in our society also need to understand that they need to encourage their women to get checkups done at early stages. They need to understand how important it is for a woman to be aware. And it's their wives, their mothers, their daughters, all of them. So it's not just the women that need cancer awareness. It's as much important as it is to have men aware in this country.
Dr. Shona, if I can bring you in here. You've worked a lot. You've organized a conference. You've organized meetings of breast cancer survivors. Do they come in late? Do women themselves feel that their health takes last priority in too many families?
Educated women coming in late. How long have you had the lump? A year, 2 years. Why did you not come in earlier? Daughter's exam, somebody else getting married, husband needed me more, he was ailing, I needed to take. So there are umpteen excuses for women not to come and get checked when they have a problem. It's kind of an ostrich principle. If I don't know, nothing's going to happen to me. And, we need to really work on this.
Dr. Eric Weiner, is the situation different in the United States? Are more women coming in for early screening and catching breast cancer earlier?
Well, breast cancer is much more in the public eye in the U.S. There is a great deal of screening. Not everyone gets screened, but the majority of the population gets screened. And perhaps what's even more important than that is this awareness of breast cancer, so that when a woman detects an abnormality in her breast, she's more likely to come in for medical attention. And as an outsider here, I'm struck that that is perhaps what's missing here in India, is the fact that people don't recognize that when there is a change, they need to come in.
Dr. Sirohi, what is the incidence of breast cancer in India? How serious is it here?
See, Bangalore is where we are sitting today, is the breast cancer capital of the country. So the incidence is 37 per 100,000 women. And in rural India, we did a study, it's about 2 per 100,000 women. In a place like Mumbai, it will be 22 per 100,000 women. It's still not as high as the West, where it is above 100 or 200 per 100,000 women. So the number of breast cancer patients is huge in India because of the sheer population. Plus, we have a younger age pyramid. So we are seeing more younger patients with breast cancer. In London, when I was there, I would see a 23-year-old maybe every 2 years, 3 years. But here, it's quite common for us to see patients who are very young.
You said Bengaluru has such a high rate. Now, I know it's a question which researchers are still working on, and I'm sure it's not an easy answer, but why?
I think it's a lot of IT companies in Bangalore, and maybe Kiran can add on to it, because there are a lot of women who are working, who are single. They're working and they don't breastfeed. Even when they have children, like I have colleagues who've come back to work after 4 weeks, 5 weeks, because a lot of corporates don't give maternity leave for 6 months. In UK, when I was there, you would get maternity leave for 6 months, and you paid maternity leave. Most corporates will not give you more than 4 weeks or 3 months. Even in US, they don't give more than 4 weeks.
But maybe there's another aspect to it, Bhavna, which we should also not overlook. One is that because we have so many tech companies, there is an annual health checkup, and a part of that is about
early detection.
It is about breast cancer
Early
checkups
detection and the reporting of it.
The reporting
Yes,
of it. So I wouldn't completely sort of say that just because you have young mothers who are not breastfeeding and that's the reason, but I also believe that because we have such a huge working population that goes through annual checkups, in a way you are actually seeing early detection of breast cancer.
But there are other risk factors of breast cancer as well. We are not exercising, we are working late, our food habits. All of these also contribute to breast cancer. Having oral contraceptive pills for a long time or hormone replacement therapy.
You've set up the Women's Cancer Initiative. Do you believe that an NGO like yours, relatively outside the system, do you think you can actually impact research in the way it's being done in this country?
Yes, I'm actually very grateful and glad that we've associated ourselves with one of the topmost hospitals in the country, the Tata Memorial Hospital. Some of the leading doctors from that hospital have taken on research projects, which WCI, which is Women's Cancer Initiative, is funding. And a lot of breakthroughs are coming through. So, as I said, unfortunately, research is not looked upon with enough seriousness in this country. Sometimes when I go to a donor and they ask me to send my balance sheet because they want to send a donation to the foundation, and they look at a large sum and they say, this was transferred to another account. Where did it go? And I said, sir, this went to research. And they said, but we want to support women's treatment. And I said, this research, funding research, will probably impact the treatment of thousands of women in the future, which will probably give you breakthroughs specific to Indian women and the conditions that Indian women are living with.
I think your donors see this immediate relief of providing somebody with medicine rather than a down-the-line, long-term approach.
And even though the government has given 100% tax rebate on research donations as vis-a-vis to when you give a donation for, an NGO or whatever. Even then, people are not giving you enough money as donations towards research.
Now, Dr. Mehrotra, you're with the ICMR, you're really at the core of this. How welcome would patient suggestions, patient recommendations for the way research is going? How seriously would you take that?
Well, I don't think I have any alternative. It's a no-brainer to say we will definitely take it up as seriously as it should be taken. After all, it is the patient's life. It is her body. In nearly every ethics committee, or the IRB as it is called, in every major research institution, you have to have a layman's point of view, and ideally that layman should be a person who's gone through the problem himself or herself, or closely related. As per the Indian Council of Medical Research norms for ethics committee for any institution, this is a must. Coming in from a doctor, the physician, that this is right and this is wrong, those days are probably going to be over very shortly. Already people are looking at it. The internet has actually played a major role, at least in the urban areas. I've had people come to me with a big sheet for printouts that, doctor, this is my problem, and this is the mainstream therapy, these are alternative therapies. Should I have gooseberry juice or should I have papaya juice?
Yes.
No. In a way it is good, at least people are knowing. However, not everything on the internet is correct, not everything is verified, and this happens all over the world. It is not, and it is slowly coming up in India as well. But having taking into consideration all these issues, I personally feel that patient advocates and patient groups, as a matter of fact, you might be knowing about this, we at ICPO and ICMR, we came up with a website which has just come up in the last year or so, which gives you India-specific information. It is called cancerindia.org.in. Our mandate to put everything together, give not only the common myths and facts, your quiz, as well as what are the treatment centers available in India, and not only treatment centers, so far it's the government, hopefully we'll get something in the private, but also where is financial help available. You'll be surprised to know, Maya, that at the moment, even government physicians do not know where to get finances from. So I'll be very happy to actually promote this website.
Dr. Raghuram, you're treating so many people, you're a surgeon for so many people. Do you feel that is also changing? Do you perhaps yourself listen more to patients and what they want, or is it always a one-way traffic in terms of what you feel should be done?
Yes, when I was working in the UK, my mother was diagnosed with breast cancer, and one of the things that, whilst discovering about many facts relating to India, I realized that counseling is not part of the medical curriculum. And counseling is so much an important component of cancer care. So as Devika Bhojwani said, when the diagnosis of cancer is mentioned by the doctor to the patient, it's like a veil. You have to explain again, and you have to explain in simple terms. You have to involve the family. And spending time with patients is 50% of the treatment.
Now, you have had great success. The group you represent has had great success in raising these funds. I mean, we talk about millions of dollars being raised for charity, billions of dollars being raised for charity in the United States. I know that families there sometimes set aside a portion of their annual income for charity. What's the secret?
The U.S. in general is quite philanthropic, and it comes in really two forms. One, there are wealthy individuals who give generously, and then for an organization like Komen, it's much less about that and much more about grassroots fundraising. And so Komen has used this series of races, the Race for the Cure, to raise money through walks and runs around the United States in small and large communities. And you know, there are many different ways of raising funds. They've been particularly successful.
I've been thinking about what Dr. Weiner's been saying, that part of the Komen funding is coming at the grassroots level. And I've always had a very funny thought, because Pune has a 5 million population. The cost of a nice cancer center would be 5 million. So all everybody has to do is donate 1 rupee. I've often thought of these things, you know, that it doesn't mean that somebody's got to give the 5 million. It
Not
can
from
be
the
a
outside,
whole
it'd
lot
be
of people within a city, within a community, who contribute a little bit.
Yes, I think the time has come. To put very, very briefly, as I think NDTV, as a matter of fact, I must thank your organization for getting cancer to the fore, probably more than most other TV channels. And the government can only do so much. I mean, I do not deny that it should have the lead, and it does have the lead role. However, screening, for example, for common cancers that they are detecting early is only being done by hardly 1 or 2 states in an organized manner. And the lead state that way is Tamil Nadu. Karnataka was supposed to start, and actually, I think Tamil Nadu deserves a big hand. They've done a wonderful job, funded by the World Bank. Unfortunately, the entire north, the east, there's hardly any work done. So as the government of India, we are definitely seized by this, and taking up from Kiran's idea, and many of the people sitting right here, I'll be the first one to take the lead.
What is the funding like for the ICMR? Is it adequate? Do you need more? Is the government funding enough?
You hit a very raw nerve here. You hit a very raw nerve here. Unfortunately, as compared to 4 to 5% of GDP with most of the developed countries, and they are fighting with that 4 to 5%. Yes. At the moment, in this country, we are less than 1%, as Kiran
was saying,
very appropriately mentioned. We need to put in money. And you know, as we say, if we do not look after our health and education, where are we going to go?
I think we're not only underinvested in healthcare, but we are hugely underinvested in research.
In research, yes.
If you look at research spends today in terms of GDP percentage, we are less than 3%, okay? And most of that research spend is not in health sciences. It's in space research and nuclear science and, and defense.
So the budget has been cut down by 30%. At the moment, it's very difficult.
It's been cut by 30%.
At the moment, we're just really running on the existing programs and salaries, and we really are seized with the matter, and the Department of Health Research is looking after implementation. If we cannot implement what we are researching, it doesn't make sense. So it is a constant battle. We have been promised that the funding is going to be at least got back to where we were, and I'm hopeful it is done, say, by next financial year.
The government in the United States does give a lot of money. It doesn't give as much money as it used to give, and we all complain about that.
There has been a lot of resistance to drug trials, especially trials perhaps in India, a lot of feeling that third world people are being used as guinea pigs.
In India, I think you can see that cancer drugs and the clinical trials and the patients that actually participated in those clinical trials actually participated in breakthrough technologies. Cancer is one area where there is huge patient advocacy to actually restart clinical trials. There are, families who really want their patients to, benefit from new drug trials.
Devika, when you were being treated, would you have gone in for an experimental treatment? Were you open for that?
No, it was too early.
Too early.
I think it was getting through for yourself. It became a personal journey, and the golden rules were applied, and whatever was the right thing to do and what your doctor, I think you were too raw and emotionally too unbalanced at that point of time to give yourself. But now in retrospective, when I look back, yes, if it would mean a breakthrough, it would mean cheaper, better quality treatment, and give yourself to research, maybe one would do it.
Dr. Raghuram, as somebody who is also treating, as a surgeon treating patients, would you be ready to try a drug that was still out there, still in formulation? Would you be ready to take that kind of risk with your patients?
Absolutely. The important thing is, in our medical curriculum, coming back again, we are not taught how to do research. Even in post-graduation, we are not taught. Research is not part of medical curriculum, just as counseling is not part. So if the inbuilt mechanism, starting from training, from MBBS, from post-graduation, research is inculcated. If postgraduates are encouraged to do research, very sadly, very few trials emanate from this country. And it's because of the fact that we are not trained. It's the mindset.
These roadblocks really should be relaxed as much as possible, but provided that the patient interest is looked into. That is the sort of cornerstone we are looking into it. Unfortunately, in my personal opinion, we have gone the wrong way. We've just become too strict about it.
Our patients, not only are they not well informed, a lot of them are not even educated. And so either you will get them as guinea pigs and they'll say yes, and I think that's a very cruel thing to do because you're not giving them the downside, or you'll never get them. So there has to be some way of getting across to them how it would benefit not only them but a much larger section of society.
Devika, we started with you, we'll end with you also, somebody who has actually gone through this, fought it. What would you like to see going ahead?
I'd like to see a breakthrough in the cure. I'd like to know that very soon breast cancer will be just a disease that you will live with, and it'll be in control like a diabetes or any other health issue.
Absolutely. Thank you so much. Well, cancer, an issue, as I said, which affects every single one of us in one way or the other. Hope really here from the panelists who have spoken about the way ahead, the need for low-cost treatments, the need for basic research to be encouraged, the need for better clinical trials to go on in this country as well, a certain amount of hope being generated for this issue, which affects every single one of us, and the breakthrough perhaps coming out of India in the near future, we hope. Thanks for joining us today. Thank you.